Hello, good afternoon everyone. Myself am Naveen Kumar from Sarun Nagar. I would like to share something regarding myself. Actually, I met with an accident in the month of April. So I got my both legs injury. I thought to go for surgery. At that time I don't know which hospital should I prefer. And I went to Yashoda Hospital, Secunderabad, and I met with an Dr. Sai Tirmal Virla, and he gave me a nice suggestion for surgery. And before surgery, sir gave me some suggestions how to take a rest after the surgery. After surgery, you can walk, you can do everything within the 9 months. Now I am very happy walking myself, and in hospital also staff gave very nice caring after surgery. After surgery, sir gave suggestion to go for physiotherapy for every 15 days. After physiotherapy, now myself feeling very good, and I am slowly walking myself. And special thanks to Dr. Sai Tirmal Virla.
Hi, I'm Dr. Sai Tirmal Virla. I'm a consultant orthopedic and arthroscopy surgeon at Secunderabad, Yashoda. Today we are here to speak about one of my patients, Mr. Naveen Kumar. He met with an accident few months ago, after which he was diagnosed with a right knee meniscus tear and left knee ACL tear at the outside hospital. He was advised surgery outside, but he was postponing it due to his personal reasons, and he had many concerns over the surgery, so he was not ready for it. So one of his friends referred him to us. After meeting us, we examined him and explained him about the need for surgery. He had a right knee meniscus complex tear, bucket handle tear, and a complete ACL tear in his left knee. After examining him, we explained him pros and cons of surgery and why he needs to get operated, and he had many concerns about his recovery. We answered them, and we told him about how it would be in the post-op and how the recovery would be, and what all activities he can do in the post-op, and how long it would take for him to get back to his routine. It's been almost 6 months since we operated him. We did a right knee arthroscopy, meniscus repair, as well as left knee arthroscopy and all inside ACL reconstruction in the same setting. Patient is confident and comfortable at this point of time, and he was quite regular with his rehab physio visits, which helped him with the faster recovery. And he's yet to get back to sports. I'm pretty sure with this good rehab, he should be back to sports as well.